Hello everyone, my name is Ishan and welcome to Ich Nissan, which is Australia's first multilingual dialogue center. So the focus at Ich Nissan is to convey online lectures, to conduct dialogues on social issues, also engage in publications. It's more like a think tank where you can also participate. So if you're keen on participating on any particular issues that you would like to present your views on, get in touch with us and we will try to see how we can arrange a dialogue and a meeting session with one of our experts or with myself. So welcome to guys. This is lecture number 16. In this particular lecture, we are going to compare the healthcare system between two countries which are very close to me, India, where I was born, Australia, where I'm currently residing. So we're going to compare the healthcare between India and Australia in this particular video. There is no, the intention of this video is pure comparison based on the facts. So each person to their own opinion. However, we cannot escape the facts. So it's going to be fact-based, and then each person can make up their own opinion based on what is being presented today. So a lot to think about. I'm also looking for a lot of queries and suggestions, or actually comments from people who are passionate in the healthcare system. If you are passionate and you want to reach out to us with your opinion or with your analysis of the situation, make sure you like and subscribe to this particular YouTube channel called Ich Nissan, spelled as I-C-H-H-N-E for me and S-A-N for San. Also click on the bell icon so every time I upload a video you get a notification and you won't miss on anything. Once you open the YouTube video, you will see a comment section. Make sure that you write your comment, whatever it is, more constructive the better. Write your comment in the comment box so I could respond to it, and also people around the world who feel quite passionate in responding to such queries will get in touch with you. So this is a way in which we can communicate with the rest of the world in a very constructive and academic, in a very literature-based, fact-based manner. So I look forward to your comments on the YouTube, in the YouTube comment section. And now let us begin our lecture number 16, where we compare the healthcare between India and Australia. Now, as I said, I will be presenting the facts to you. I'll be giving you an analysis from an economist point of view, but I really appeal to all the doctors, to all the healthcare professionals, all the physiotherapists, occupational therapists, speech therapists, okay, nurses, everyone in the whole healthcare system to come out, speak out, and write in the comment box. Tell us what's the ground reality, because you are the ones who are working in the hospitals. You are the ones who know what is actually going on. So my job will be to give the numbers, and then my appeal is to all the healthcare professionals to write in the comment box about what they're actually facing and what the ground reality is. That way the world can know firsthand from you what is going on, instead of relying on media who could be biased. So let us begin our session, everyone. See, the first things foremost, India has only half the number of doctors required to meet the World Health Organization standard. That is of one doctor for every 1,000 people. So that is something of concern. This is also a topic that can raise many questions. We can have a discussion on this, that why is it that we have Indians only have half a number of doctors that are required? Where is everybody else? Is it because they are leaving the country for overseas countries, or are the numbers just inflated when we get to know how many people are passing from the medical school? So what is going on over here? We see a lot of emphasis on people to become doctors and engineers. Now, maybe there are more engineers, but what's going on over here? So something for people to discuss later on. India ranks 170 out of 188 countries in domestic general government health expenditure as a percentage of GDP. So this is literally to do with the government spending section. We all know, I've done a lot of videos on GDP. GDP is basically with the expenditure approach, C plus I plus G plus NX, consumption, investments, government spending, and net exports, that is exports minus imports. So when it comes to the government spending part, how much percent is the government spending on the healthcare out of the overall expenditures towards the GDP? So this is what is seen. And when we look at the ranking, India's rank is not that great. It is 170 out of 188 countries. The public expenditure on health as a percentage of GDP for 2017-18 period in India was 1.28, that of GDP. So we round it up, we say 1.3%, but that is the only amount, the only part dedicated for healthcare out of the total GDP expenditure. So that is of concern. Now, of course, these numbers were the reliable numbers and the reliable data that was available from 2017 to 2018. At present, of course, the numbers have increased. There are new policies that have come into place, and we will have a look at those very soon. So let's look at the budget allocation. So the budget allocation for the Department of Health and Family Welfare, it had surged from rupees 37,061 crore in the financial year of 2017 to rupees 65,000 crore in 2021. So there is a big increase, which is good. So this is commendable. And the government aims to raise the public health expenditure from 2.5% of GDP by 2025 in a time-bound manner. So we saw it was 1.3. The aim of the government is to get it up to 2.5%, still very low, but see, from 1.3 to 2.6, it's almost doubling it. So that should be the positive part, that it's almost planning to double it by 2025. There are pluses and minuses. This is good. It's doubling. It's still less, which is not the best part. And by 2025, so we're really looking at a few more years. So it could be done earlier, maybe. However, the expenditure budget on medical research has not increased significantly. Anyone working in medical research in India can attest to this, that the research facilities in India really lack the international standard or the funding that is required. So yes, there is spending on healthcare, but the medical research part is significantly neglected. The expenditure budget for research was rupees 1,727 crore in the financial year 2019, which has grown to 2,100 in 2021. So that increase isn't much. You can see the allocation for the Department of Health and Family Welfare has gone up from approximately 37,000 to 65,000, but for the research, it's gone up from 1,700 to just 2,100. So that increase isn't very significant at all. Now, including the private sector, the total healthcare spending in India rose to 3.6% of GDP in 2016, but even this is very low compared to other countries. So in case you're getting confused, what was that 1.3% that I spoke about before? What is this 3.6%? You see, when we're looking at complete healthcare, okay, private and public, total overall healthcare in the system, in the country, the spending is 3.6% of the GDP. But when we are keeping the private part aside and just focusing on public healthcare, so the sole responsibility of the government, that one is very low. That is 1.3%. So those were the two percentages, just in case people were wondering why it says 1.3%, then it says 3.6. 3.6 is for the overall healthcare sector in India. So that's the total spending. So the average for OECD countries in 2018. So the reason why I'm saying this total is still low, even if it's 3.6, why is it still low? Because the OECD countries, in 2018, the average was 8.8%. So total spending were being 8.8%, that of the GDP. Now we know why 3.6% is considered low. In the US, it is actually 16.9%, that of the GDP. In China, it is 5%. In Germany, it was 11.2%. In France, it was 11.2% as well. In Japan, it was 10.9%. So we get a little comparison and understanding here why 3.6% is considered low. But it's not all bad news. There is some good news as well. So we have the Ayushman Bharat Pradhan Mantri Jana Arogya Yojana, that is the ABPMJ. It is a part of the Indian government's national health policy, which aims to provide free health coverage at a secondary and tertiary level to its bottom 40% of the poor and vulnerable population. So kudos, this is brilliant. I'm sure the only argument that will now arise is whether it's being used or not, and that's for people to decide, okay? And that's why I'm really appealing to the health professionals to speak up instead of people who rely on news and rely on WhatsApp to speak and comment. It'll be nice to hear the health professionals give their first-hand experience and tell what they are facing or if this is really being implemented. So we like to hear from them. The PMJ is the world's largest, let's get the facts right though. This is the world's largest and fully state-sponsored health assurance scheme, which covers a population that is combined size of USA, Mexico, and Canada. So it is huge. It's brilliant. We just have to now comment about. There's no doubt whether it's good or not. Okay, there's no argument here. The argument will be, like I said, whether it is being implemented or not. It was launched in September 2018 by the Ministry of Health and Family Welfare in India. So I would appeal people to research more and pass on your comments about this as well. Unfortunately, like I said, there are some arguments. There have been media reports. Now, trust me, these are media reports. It depends. Some media is biased. They might have reports deliberately against the system. Some media is biased pro, so they might inflate the actual use of the policy. So we could have those two media reports. However, there are media reports of the misuse of Ayushman Bharat scheme, not by the government, but by the hospitals actually, in manipulating the medical bill. So under this scheme, surgeries have been claimed to be performed on people who have been discharged long ago, and dialysis has been shown as performed at hospitals not having kidney transplant facility. So here now the problem is not what is being allocated, but how certain, not all, certain hospitals are misusing this particular policy for their personal gains. And this is to do with senior management and people at the top level of the hospitals. And I'm sure a lot of medical people in the medical field may not want to speak up. They might fear losing their jobs. But of course, you can have an anonymous account and you can make up an anonymous hospital and definitely write your comments and let us know what is going on. How about Australian healthcare? It is considered, I'm not saying so, of course, nobody in Australia is going to say it's one of the best, because people like to critique, and see, healthy critique is good because that actually pushes the government to strive harder to help the people. But it is usually considered as one of the best in the world. There is a uniform, universal Medicare card system. So with this card, it's an insurance card. Everything is free basically, unless you go to a private hospital. Everything is free. Depends on the level, the premium that you're paying, and the platinum or gold level that you have on your card. But at certain levels, even private surgeries or surgeries that are to do with that are non-essential are also covered sometimes. It depends on the level that you've gone for. But if you're going for the basic level, of course, your plastic surgery will not be covered, but any other essential surgery will be covered. So we have the Medicare card system. In fact, the brilliance of the healthcare system was really demonstrated during this COVID-19 situation. So you see, each and every person who was placed in quarantine, whether it's a domestic person or it's a person who is traveling to Australia from overseas, whoever was placed in a quarantine, all the expenses, including the hotel stay, the food, everything was paid by the government. So no one had to pay anything when they were in quarantine. And I'm talking not just of citizens, but even overseas travelers who were placed in quarantine. The government paid for everything. Okay, so quarantine was free. The COVID-19 tests were also free of charge. So no one had to pay for the tests either. The number of tests that took place in Australia was insane. It was really, really commendable. Each and every, almost all shopping centers, that is malls, they had a testing facility. A lot of like stores like Bunnings. So how do I explain to you what is Bunnings? So basically, it's a superstore, super retail store which only sells equipments required for tradies or for DIY purposes. So you can have hundreds of hammers, bulbs, a lot of tools, for example. So Bunnings was an example. So their entire car park was dedicated for testing. Similarly, large retail chains, had also dedicated their car parks for testing. In fact, there was mobile testing as well. There were ambulances on streets, then they asked people to come out and get tested. All of this was done free of charge. So people didn't have to pay for quarantine. People didn't have to pay for the test as well. And this was because of the level of healthcare that was established in the country. And now we come to know why the percentage spending of the GDP is very essential here. In some countries, it's very low. We have seen in one of the previous videos, or in this one, how it's around 3.6% in India, or 1.3% when it comes to public. In Australia, it is 10% of the total GDP spent on healthcare. And that's why the government is actually able to provide these free facilities. Now, I do understand some people, and I have raised this question in the past, that it's possible for Australia to spend so much on their healthcare because the country is not at war, it's not having any border issues. Countries like India do have border issues, and they constantly have to pump up and boost their um, military spending, and that's why they are not able to spend enough on healthcare. This is an argument. I'm more than happy. I welcome people to continue this argument in the YouTube comment section by all means. Whether you agree with this or you don't agree, it will be nice to see balanced views based on research, authentic research, of course, in the comment section. But let us understand one thing. For those who say Australia does not have any border issues and that's why Australia can pump in a lot of money in the healthcare, that is not a valid argument at all, because Australia, although is not at war or is not having border issues, it's actually involved in a lot of international operations. And let's have a quick look at the Australian Defence Force members who are actively protecting Australian borders and offshore maritime interests. So this is ongoing. This is where Australia is actually involved in when it comes to military operations. So it's not true that Australia doesn't have to spend on military. They have to spend on military, and yet they're spending on healthcare as well. So there are 600 personnel in the Middle East region. It's ongoing. There is an operation in South Sudan that is reviewed annually. There is an operation in Middle East region for maritime purposes. There are 220 personnel engaged in there. There are people in Egypt. There are people in Iraq, Israel. Also, Australia has their maritime interests with their maritime partners in different seas against, of course, countries posing a threat. And there is an operation ongoing in Afghanistan as well. The names of the operations are given to you. For example, we have Aslan, Manitau, Mazurka, the Okra, Paladin. So these are different operations. So very actively involved in what is going on around the world, although the country is not at war. And that's why there are some lessons to take away from this as well. What do you think? Do you think Australia could contribute more in healthcare? Do you feel it doesn't deserve to be called as one of the best in the world? Do you feel there are parts of Indian healthcare that are not mentioned by the media that you're aware of and you like people to know? The only way to get your thoughts across is if you comment on the YouTube box, like and subscribe to the video. So do contribute, and I look forward to interacting with you in my next video. Until then, stay safe, and I'll see you next time.